Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Tracy, 1 in 6 women in the United States takes antidepressants, and a common side effect of those antidepressants is sexual dysfunction.
Sexual side effects can include different areas of sexual response, such as problems with desire, arousal, orgasm, pain, and general satisfaction.
That's a lot of problems.
Oh, boy.
Well, when it comes to side effects, not all antidepressants are the same. So it's important for women to be willing to talk with their doctor or their psychologist if they're having problems with their sexual function.
A paper being published in the September issue of Proceedings shares new research on antidepressants and sexual side effects for women. Here to discuss that article is co-author and Mayo Clinic psychologist Dr. Jordan Rouleau. Welcome back to the program, Dr. Rouleau.
Thank you. Thank you for having me.
That's right. We go right to the source. Dr.
That's
Rouleau
right.
is one of the co-authors. So, Dr. Rouleau, let me ask you. So, 126 or 125 million adult women in the United States. You divide that by 6, you get 21 million. And that's 15 to 20% of the population, females in this country, are on antidepressants. Really?
Really?
Why?
Experiencing symptoms of depression.
Really? Do you think it's that common? And,
Yeah. Yeah.
So it didn't used to be that way, did it? A decade or 2 or 3 ago? What did women do before all these drugs came on the market that they advertise on TV and then they're prescribed for women in the country?
Just think about any mental health or medical concerns. What did we all do when the solutions weren't out there or treatments weren't out there?
Suffered through them.
Yeah. Yeah.
And
So the diagnosis, a woman comes in and says, "I feel depressed." Is that an indication to give her a drug, or are there some more objective criteria that you use before you would prescribe something?
There are criteria. So when we think about psychologists, there's the Bible for psychologists is called the DSM. Current DSM is the DSM-5, the Diagnostic and Statistical Manual of Disorders. And in that DSM, there are a set number of criteria that someone would need to meet in order to get a diagnosis of depression. So some of the criteria are not having motivation, poor appetite, so eating less or eating more than typical, having a hard time getting out of bed, feeling sad more often throughout the day than not. So those are some of the symptoms. And if you meet a certain number of these criteria, then you get that diagnosis of depression. And you have to have those for at least 2 weeks. So this is something you're feeling for a couple weeks. I'll see patients where they say, I felt that for a day last week. Well, that's not depression. That's just feeling emotions.
And do you think that antidepressants work?
They do, yes.
Okay.
And why do they hinder sexual performance, or why do they take away from our sexual satisfaction?
We believe that the main reason they cause sexual side effects is because of the change in neurotransmitters, the balance of neurotransmitters, specifically serotonin. So serotonin is a neurotransmitter that when there's more of it in your body, it's going to inhibit desire, arousal, orgasm. So we think it's because of the serotonin piece that really takes a hit on sexual function.
And are there any antidepressants that have less of an effect on sexual function? I mean, if it's a problem for a woman, do all of these drugs work the same way, in other words?
No, they don't all work the same way. There are several that have less sexual side effects. Wellbutrin or bupropion is one of them.
Well, that's the one they use to help people quit smoking.
Yeah. Mm-hmm.
Same, and you use it for depression also.
Yes. Mm-hmm.
So is the paper that you published in the Proceedings, this is all about encouraging women to find other antidepressants, or what's it about?
So it's a concise review of the sexual side effects caused by antidepressants, and then what are some brief effective treatment options, ways to manage those sexual side effects. More often than not, women, both women and men, are experiencing sexual side effects with their antidepressant. They're not telling their physician isn't asking, and then they're just stopping the medication because they're thinking, well, this is causing sexual side effects. I don't want to be on this. This isn't worth it. So they just stop taking the medication. They don't tell their doctor why they stopped. And then that was a treatment intervention that could have been helpful for them, but they're not doing it because of sexual side effects.
Yeah, if the sexual function takes a hit and you're depressed, and it's kind of a downward spiral.
Yeah. So what we're trying to say in this article is there is good research with some very brief interventions and relatively effective interventions that can help you manage those sexual side effects if you're having them, if you're not on antidepressants.
Such
Like
as?
what? Yeah.
Yeah.
Okay.
Let us know.
Sorry.
Yeah.
Did we jump in there too quickly?
It depends on what sexual side effects are you having, and you got to think about the different domains of sexual function. So, is it low desire? Are you having desire dysfunction? Are you having an arousal dysfunction? Are you having an orgasm dysfunction? Or is it impacting kind of overall sexual dysfunction? And based on the domain that you're experiencing a side effect in, then that determines the treatment protocol. Some of my favorite management strategies are for arousal. So difficulty with sexual arousal, there was a really neat study that looked at exercise for women who are on antidepressants who are having sexual arousal difficulties. And what they found, now I don't know how easy this is to do in real life, but what they found is if you do moderately intense exercise 3 times a week, preferably right before you have sex, that actually will help increase your sexual arousal. So this is for women who are on antidepressants.
You said
Right
that's
off the treadmill into the bedroom, huh?
If you can, right off the treadmill into the bedroom, it's going to help with that sexual arousal.
well, the first one that you mentioned, though, was desire. What about that one?
Desire. So a few options. There are pharmacological options where you reduce the dose of your antidepressant. You can add on bupropion, Wellbutrin onto your current regimen. So those are a couple pharmacological options. Behavioral options. There was one small study that showed that women just attempting sexual activity 3 times a week, just attempting, that actually increased their sexual desire.
And what was the third one? Desire, arousal, and what was the third one you mentioned?
Desire, arousal, and orgasm.
Okay, so what about that one?
One small study, again, this tiny study that looked at using Viagra, women using Viagra, and found that it actually helped a small number of women increase their orgasm with the use of Viagra. One thing that I recommend often as a psychologist is the use of a vibrator. So when we think about antidepressants, it's kind of like they put a kind of a wet blanket on your orgasmic capacity. So imagine if you're able to have much greater sexual stimulation, like with a genital vibrator, that can actually kind of remove that wet blanket and help you reach that threshold to reach orgasm.
What about that new drug, flibanserin? Have you had any experience with that or any patients who have taken it? It seems like it didn't really take off like people expected it to for lack of sexual desire in premenopausal women.
So the physicians that work in the women's health clinic where I'm at, I don't believe they have prescribed flibanserin even once so far. Wow. And flibanserin wouldn't be something you'd think about for, let's say, low desire for women on antidepressants. No research showing that it helps for a woman who's already on an antidepressant. It would be someone it's actually only approved for women who are not currently on.
And postmenopausal, too.
Postmenopausal women, no, premenopausal women. So it's for premenopausal women. They're not currently on an antidepressant. So you wouldn't be thinking about flibanserin for what we're talking about here today. But you're right, flibanserin hasn't really taken off as many of us had kind of hoped, or at least as the pharmaceutical companies had hoped.
So the main takeaway is that there are options, and women need to be speaking with their physicians about them.
Yes, there are options. Tell your physician that you're experiencing sexual side effects. There are potentially pretty simple treatments.
All right, just one quick question. So we mentioned how common depression is in women. Is it similarly affecting as many men or no?
I don't have that statistic offhand, but I believe depression impacts women a bit more than it impacts men, and I think it's the way that women manifest. So women are going to look depressed where men might look a little bit more angry, and you're not going to see that as depression, although it might be.
And they're willing to tell their doctor about it, and the male may not be.
Exactly.
All right, Dr. Jordan Rouleau, clinical psychologist, Mayo Clinic, Rochester, talking about women, antidepressants, and sexual dysfunction. Great to have you on the program again.
And thank you for having me.